Well, it's time to close out a week of what's in store. We've been at Riverside Hospital all this week. Today we are visiting with MJ Smart, and MJ is a wound care nurse here at Riverside Hospital. And let's start by telling folks exactly what a wound care nurse does.
Well, a wound care nurse goes and assesses the wounds whenever they come in, whether it be home health, from the hospital. You know, they might not be coming in for that specific reason for wound care, but a lot of them do have wounds. And so we assess that and assess their needs, and, you know, we adjust it accordingly.
So MJ, what are some of the more common types of wounds that you guys deal with here at Riverside?
Well, we have a lot of venous stasis ulcers, which means the blood flow to the leg really isn't good enough, and they get sores on their legs, and we need to take care of that, whether it be infected or, you know, need IV antibiotics or whatever. We get a lot of diabetic ulcers. The diabetics, you know, if they're not wearing their shoes properly or something, not checking their feet regularly, they get sores on their feet and they can become infected and, you know, open wounds. So we take care of that.
And one of the benefits here is wound care specialist physicians.
Yes, we do. We have two on staff. Dr. Roberto Garcia is one of them, and we work really closely with both of them to assess the wounds.
One of the things you were telling me about earlier before we started taping was that you guys have a whirlpool tub, which to me, I don't get why that would be important to wound care. Let's talk about that a little bit.
If we have a big nasty wound and we really need to clean it up and debride it, you know, to make it look a little better, we can use the whirlpool tub. That helps with that.
So, you know, we're talking about wound care. We don't want to leave folks with the impression that they could just walk in off the street with a wound and have you take care of it like an emergency room. Folks have to be referred to you to provide those services.
Yes, you are correct. Whether it be home health, you know, the home health, you tell them, they get with the doctor, and the doctor refers them, and we go assess them and get them in.
So you guys can actually be a pretty good adjunct to home health care, because, you know, home health care, they may be limited on a number of times they can go out to the home, but having you available as an ancillary service, they can come in and get those services right here at Riverside.
Correct. We provide wound care 7 days a week.
And of course, another one of the great things about Riverside Hospital is your patient to nurse ratio.
Yes. We have our most critical patients are like maybe 2 to 1. Our regular patients who are up and about is 6 to 1. So they're very well taken care of.
So when it comes to having the time you need to heal, Riverside Hospital is the place you should consider. That wraps up this week's edition of What's in Store.